Meeting to order Wednesday, March 6th. We have a roll call, please?
Calling the roll, Ms. Conwell.
Here.
Mr. Jones. Mr. Jones is absent at the moment. Ms. Brown.
Here.
Mr. Miller.
Here.
Ms. Stevens.
Present.
We have a quorum.
Anyone signed in for public comment?
No, Madam Chair, no one is signed in.
All right. Ms. Lou is not here today. All right. Well, we hope she is well because she is always here. Approval of the minutes from the February 20th, 2019 meeting. Can I have a motion, please?
Second.
Moved and seconded. All in favor say aye.
Aye.
There's two items that are referred to the committee today. Madam Clerk, if you could please read the first item into record.
Resolution number 2019-0063, authorizing an amendment to various contracts with various providers for community-based services to support at-risk children and families in Cuyahoga County to extend the time period to 3/31/2020 and for additional funds.
All right. And who is presenting today?
Bob Math from the Office of Health and Human Services on behalf of Department of Children and Family Services.
Thank you.
Well, good afternoon.
Good afternoon.
We are recommending an amendment to our contracts with 10 organizations that are listed on the agenda to continue to provide community-based family support services which address the needs of families currently involved with in the child welfare system, families at risk of entering the child welfare system, and those youth that are aging out of the foster care system. This model of community-based services emanated from a philosophy developed by the Annie E. Casey Foundation a number of years ago that called for a partnership between child welfare agencies and the communities where these at-risk children and families reside. It was this philosophy that acknowledged that the work of protecting children needed to be a group effort. That is, the communities did not want to see their children removed from their neighborhoods, and DCFS, Children and Family Services, fundamentally believe that children belonged with their families as long as it was safe for them to do so. By providing a range of services such as case management, outreach, service coordination, emergency assistance, it'll provide space for family visitations, independent living skills instruction for those youth aging out of foster care, so they could develop those living skills. That there were a number of objectives we hope by providing these services that we could meet. Some of the objectives were overall improving family functioning and child well-being, strengthening family supports, and provide easy access to community-based services, contribute to a reduction of placement moves for children and youth and helping to expedite family reunification, increase housing stability and ensure basic needs are being met, and then provide basic living skills to those youth aging out of foster care to enhance their independence. You may recall that we issued this initial RFP back in September of 2017 and recommended the agencies that are listed on the agenda. The first year of this contract concludes at the end of this month, March 31st, and we are recommending the amendment for another year beginning April 1st through March 31st of 2020. It's in order for these agencies to continue continue to do the important work that they do for these at-risk families. You may also recall when I came before you last year, the mandate we are under to ensure that we have built into contracts performance measures, as we've done in many of our other health and human services contracts, because we need to determine if in fact the services being provided have had a significant positive impact on the quality of life for these families at risk. As a result, we included in all these contracts 4 common measurable outcomes that's across the board for all the organizations to work towards meeting, and they report their progress on these outcomes on a quarterly basis. Let me, if I can, just recap these 4 general outcomes. The first one is what we call an engagement goal. That's for these families and youth that are being referred. We'll have a completed assessment conducted on them to kind of tell them when they walk in the door, kind of how they're functioning and where they're at today. All right, and develop a service plan to kind of as a roadmap in terms of moving forward and what they need to do to actually improve the quality of their life and the life of their children. The second goal is to determine if families are in fact becoming more self-sufficient. And again, these are for both families and youth aging out of foster care. And the goal of that is to maintain an income adequate to at least meet basic needs. And it's determined by the assessment tool that is provided And then they conduct a follow-up, after they complete the initial assessment to kind of determine where they're at when they walk in the door, then they conduct follow-up visits at different intervals, sometimes 30, 60, 90 days, as long as they're engaged, after the initial assessment to determine if they are making progress on this continuum of care. All right. And the tool they use has like 18 domains, which includes anything from housing, employment, income, childcare. And when they do the initial assessment, they rate them on these domains. So if you're at a 1, that means you're coming in, you're kind of in a crisis mode. If you're at a 5, that means things are improved, and their life is stabilized. And then there's the interval in between. So when they do these follow-up, visits on these, when they do the follow-up assessments, they can determine how these families are progressing. The third measurable outcome is what we so-call safe and stable environment. And again, that's also determined by use of this assessment tool to determine this is where they came in at, and now after we provide the services, whether it's 30 days, 60, 90, 180 days, this is how they're progressing based upon the service we provide. So we can actually measure, kind of improve family functioning. The fourth goal is something called satisfaction. We ensure that each organization provides a satisfaction survey for those youth and families that have received services. And the goal of the satisfaction survey is that 85% of the respondents should, on their survey, indicate that they agree or strongly agree with the statement, "I'm satisfied with the services I've received on the survey." So those are the 4 goals that we've established that we think these organizations have, control over. And those are the goals that we're striving to achieve. This past year was the first year we implemented these performance-driven outcomes. So there is a learning curve, but I'm pleased to say that all the organizations are working hard to achieve them. And as we look at their performance and all the goals, they are trending up each quarter. So we have reports for obviously first 3 quarters. The last quarter is January, February, March, which of course we're in the middle of that quarter now, but they are trending up, which is a positive sign. That being said, one of our biggest challenges is our mechanism, or more specifically, the database that is currently being used to collect all the data. And they've been using this database, Collaborative's been using the database for several years. We have discovered, as we've looked at the data, a number of glitches, but we are committed to fix them, because we need to ensure that the data that is collected is reliable and has a high degree of integrity. What I'd like to do is take another few seconds just to kind of give you a sense of how many families these organizations are reaching out and they're serving. Through the first 10 months of this contract year, which started, of course, April 1 of 17, through January, they've received more than 4,500, as an aggregate total, they've received more than 4,500 referrals. And these referrals come from, of course, Department of Children and Family Services. They come from other community agencies, as well as they come from families that just walk in because they need help and they need assistance and they need some services. When you look at many of the families receive ongoing services. So among these 4,500 referrals, they serve about 800 families per month. So the traffic is, is fairly consistent, it's fairly large, because oftentimes these families, many times it's not a one-time only service. So they come back for recurring services. Also during December and January, we conducted our team conducted our on-site monitoring visits at each of the organizations, which included a thorough case file review to ensure activities and/or services provided to our families were all documented. And while the reviews and our on-site visits went well, we were able to identify some areas that required some improvement going forward. And we've shared all this. We've shared this information, of course, with all the organizations, and I think they're all working on, performance improvement plans. So hopefully this will provide you a little background, kind of where we are and where our plan is going forward. And while we do recognize there have been some challenges, we are confident that we can continue to provide quality services. These organizations continue to provide quality services to all these families that are most at risk in our community. So it's a little background, and we'll be happy to entertain any questions you might have.
I would just like to say I believe the neighborhood collabs are are twofold. One, prevention from coming back into our system, and number two, helping families reunifying with their families. So personally, I feel this is a very needed service that we have, because if we did not have the collabs, then DCFS would have to do all this, and we know that the department can't handle that. So I just wanted to put that on the record. In terms of my two questions, you made a statement about 800 families per month. Is that overall?
Council Chair, that's an aggregate.
Okay, and then the children that are aging out of the foster care system, they don't have a mom and a dad. So is it still the same mechanism where they're referred by DCFS and then it's up to the young adult to go to one of these agencies? Is that how it's carried out?
Yeah, and then the agency will provide whatever services they think that youth may need to help them develop those independent living skills.
Okay.
And connect them with the appropriate resources in the community to assist them when emergencies surface.
Okay, and the couple of instances that, you said there's some learning curves and things, and I know that we're working on those on an individual basis to work those out. So we will get what we need as a county council for the residents of this county to make sure that we have performance and we have some oversight to that, but they will be worked out. I'd like to open it up to anyone that has any questions. Councilman Miller.
Madam Chair, to Mr. Math, where it says for the time period 4/1/2018 to 3/31/2020, is that supposed to read 2018 or 2019?
Oh, well, we're amending, the current contract ends in March 31st of 18, of 19, you're correct. So it ends the end of this month, and the amendment is going to go for another full 12 months.
So this legislation is actually for the time period 4/1/2019 to
March of 20.
right, okay. And
The agenda, they backdated to the beginning of the initial contract, so that's why it appears on the agenda like that.
And is there any change of agencies going forward, or is it the same set of agencies?
Through the chair, Councilman Miller, these would be the same 10 organizations that we're amending, all 10 of them.
And how many further extensions could there be before you go out for bid again?
Well, through the chair, Councilman Miller, generally we do the initial one-year contract and we build into the RFP 2 one-year options. So it's conceivable, barring, agency priorities and funding availability and agency needs, we could conceivably amend it for yet another year. I mean, if we choose to change the scope and want to issue another RFP, we can surely do that as well.
Okay, thank you.
Any other questions? All right, here. Okay.
Madam Chair, I would also like my name added.
True. Put us all on there. All right. Well, we don't have anything else that you'd like to share. I'd also like to, we always are due diligent to have community representatives come out, and I'd like to hear from them if there's anything that they would like to share while they have this time, that they're more than willing to come up and add.
I think many of you probably know Ms. LaJean Ray. She's an institution in our community.
Okay,
A good
institution.
one, a good one.
I just want to acknowledge the commitment that we continue to make to serve the families in our respective areas. We appreciate your support, your ongoing support, and we're very, very privileged to have seen much more engagement and involvement from you all this contract year. We appreciate that as well. And we pledge to continue to do the best we can for the families that you're entrusting us to serve. Thank you so much for your support.
Thank you. Director in the back? Well, you gotta do it on the mic. You
Elaine, you may have to come up.
gotta state your name, where you from,
You
and
need to be on record.
How are you? Elaine Goldston from the Harvey Community Services Center, and I agree. We are so thankful to be able to provide the kind of work that we're doing. It is so necessary, and we're so concerned and compassionate about our families. So we're going to make sure that we continue to do the best that we're doing, and also not have to have Bob upset because he's going to have to pull us together and talk to us, which he makes sure that we are aware of what we need to be doing and what we needed to get it done. So we're real proud of having someone who's committed to work with us. So thank you, and thank all of you for your support. Thank you.
You're welcome. It's always good to hear from the ones that are actually working close to the families.
Rachel?
Good afternoon, everyone. I'm Rachel Milner from the Westside Community House, and I just wanted to echo what my colleagues have said. And just as it relates to the measurements that we're using and the challenges, we're committed to grow. We're committed to being able to collect our data in anecdotal as well as quantitative information. So we're just looking forward to the next era of the work of the community collaboratives.
Okay, what's your last name again?
Milner.
Nice to meet you.
Thanks, Rachel.
All right, so Bob, it seems like we're all committed. Okay, so we're gonna get it right. We're gonna work out the issues, and would like to proudly make a motion to move this to, probably gotta do second reading suspension, right?
We have 2 more meetings in March, so that's
Okay.
your call, Council Chair. There is enough time to do the 3rd reading should you so desire.
Some things are working here.
We do our best.
Okay, well, I'd like to make a motion to move this to the full council under second reading. Is there a second? Moved and seconded it twice. All in favor say aye. Aye. All right. Thank you, Bob. Thank you all for coming out.
Thank you.
I do want to go back to one of the housekeeping items, even though we're not have to excuse members from committee meetings. I'd like to make a motion to excuse Councilman Jones. Is there a second? Moved and seconded twice. All in favor say aye. Aye. Madam Clerk, if you could read the next and last item into the record.
Resolution number 2019-0064, authorizing a contract with the Salvation Army in the amount not to exceed $538,467 for the Pass Rapid Rehousing Program for single adults in connection with fiscal year 2017 HUD Continuum of Care Homelessness Assistant Grant programs for the period 10/1/2018 to 9/30/2019.
Good afternoon.
Good afternoon, Shari Weir from the Office of Homeless Services. We are requesting approval of a contract with the Salvation Army to continue the past temporary housing program for single men. The focus of the program is to rapidly rehouse those men who come to the program. The funding is through the U.S. Department of Housing and Urban Development in the annual competition for homelessness assistance. PASS was originally funded in 1998 as a transitional housing program, and the funding has been renewed every year since then. In 2016, our local housing homeless continuum of care reallocated the transitional funding to rapid rehousing and designating PASS as a temporary housing facility so that the program would align with the evolving goals and priorities of HUD, and the funding would be maintained and the services would continue. Clients are served at the Harbor Light Complex at 1710 Prospect Avenue. The accommodations are single occupancy and 2-person rooms. The program is able to serve 75 people at a time. And the Harbor Light Complex houses other community services, including detox and substance abuse recovery. The PASS staff work with clients to identify permanent housing in the community and assist them to attain income so that they'll be able to maintain the housing once they leave. The program outcomes are on the handout we gave you, but a couple of the highlights, I think, are that over the course of 12 months, PASS served 254, and 184 of those persons exited. The average bed utilization rate was 92%. And it's also noteworthy that PASS serves men with substantial barriers. With either behavioral health or physical difficulties, 78% of the people self-reported having significant barriers. 49% of the men gained income while they were at the program, and the average length of time that people were there was 133 days. Bo Hill from the Salvation Army can answer any of the other particulars about the program because he actually knows. I wanted to note that there's a discrepancy of $6 between the documentation submitted with the project and the contract amount. The contract's actually $6 higher than it should be. How those things happen, who knows? It was recommended that this continue on with the caveat that the language in the contract will be amended to lower the last digit from a 7 to a 1. And so that's what we're proposing to do.
All right, so we'll take care of that housekeeping item now. I'll make a motion to accept the proposed substitute to change the little dollar amount of $6. Is there a second? And it's moved and seconded. All in favor of the proposed substitute, say aye. Aye. So we are now working from the proposed substitute.
Thank you.
Is there anything else, Ms. Ware, that you would like to share?
No, we'd be happy to answer any questions if there are.
All right, I will open it up to my committee members if there's questions. Councilman Miller?
I know we've seen this before and heard it before, but could you refresh our memories as to why we don't get this legislation until we're halfway through the program year?
Oh, Councilman Miller, yeah, of course. Okay, so this project had an October start date. We got the grant agreement from HUD at the end of October. Then Salvation Army has to send it to their higher-ups who sign it. And then it comes back, and we submitted it, we actually submitted it in early December through the county process. And not sure where it got stuck, but it got stuck. And so, I mean, that was a glitch somewhere in our own process.
Sherry, I'd like to ask, around that time period, it was also the big NOVA
Yes.
application, so that's around November, and just wondering if that probably had some reasoning of why this one.
Well, you know what? I'd like to blame it on something else, but actually, those two things, while they're related, they took place independent of one another, and so this was actually, in the last NOFA that was that we had to do, and it's just HUD is very slow in getting these things to us, and then. There are all the steps in the county that things have to go through as well before they actually surface.
Okay, so they're kind of independent of each other.
Well, they are independent. They're related in that PASS is part of the NOFA that we were working on at the time that this contract was also being processed.
Okay. Does that help, Mr. Miller?
It does.
All right. Any
It's
other-
unfortunate. I wish it were different. The providers wish it were different.
Amen to that.
Open it up to any other questions? Councilwoman?
So if the start date in HUD.
Excuse me, can you press your microphone?
Press your green button.
Thank you. If the start date in the HUD document was October, can pass back bill to that date? If we're just passing the legislation now,
Yeah.
they'd in essence be losing 6 months of funding.
The money has to be spent by the end of September. The reality is that Salvation Army has been covering expenses that would normally have been covered by this project.
So are those costs reimbursable to Salvation Army?
You guys submit bills?
Yes,
except-
to the chair and Councilwoman Stevens. Yes, well, up to this point, in the 21 years that I've been there, there's never been an issue getting reimbursed, going back to the contract start date. And we have been submitting bills every month with the expectation. And so those bills, monthly bills, are actually sitting in the Office of Homeless Services office. So thank you for your question.
Can you state your name for the record?
I'm sorry. My name is Beau, B-E-A-U, Hill, H-I-L-L, with the Salvation Army.
Thank you. Thank you. All right, any other further questions? Anything else you'd like to share, Sherry?
No, just say that PASS is a terrific program and really an important resource in our community.
Yes, it is, and I was looking at the number of youth. You said this was a male program, so the number of youth 18 to 24 years old, I guess during this contract period, or was this last year's data?
That was last year's data.
Okay, last year's data was 11. Do you see that number has increased for the youth for this year coming in the doors?
To the chair, it's pretty consistent over the years. If we look at historical data, we see a pretty similar number of youth, similar number of overall population, and a similar number of veteran status and things of that. There's no real big fluctuations as there are with some of our other programs associated with the opioid challenges in our community.
Okay, and one question that or one thing that I'm curious about, they have the Zelma George Family Shelter right next door. If the parents come in with the 18-year-old, would they be allowed to stay in the Zelma George complex, or would they actually go next door? Because I think Harbor Light has to do, I thought, with some types of substance abuse.
Well, to the chair, we host a lot of programs, and so all of those that come into the Zelma George Family Shelter are homeless families, and they all come through coordinated intake. And we typically say that it's predominantly women and children, but we do take intact families as well as fathers as head of household. Typically, someone that is 18 years of old or older would not be with the family referred to us from coordinated intake. However, those with some either cognitive challenges and or those that are in school would remain with the family, irrespective of what the age is. So, did that answer your question, ma'am?
Yes.
Thank you.
Because I there has been at least a concern that brought up to me from our overflow family shelters and things of that nature when families come in. If the kid is over 18, then they're separated from them, and many of the families have an issue with their young male going to stay at 2100 or separated from them. So just wondered how this worked out. Okay. Any other? Hearing none, I'd like to make a motion to move R2019-0064 to the full council. Second reading suspension. Is there a second?
Second.
Moved and seconded. All in favor say aye.
Aye.
Thank you, both.
God bless you.
Thank you.
Any miscellaneous business? Anything anyone wants to bring up? Hearing none, this meeting is adjourned. Thank you.